Today we have with us Dr. Olatoye. Dr. Ayo Olatoye is an NHS doctor in the Manchester area. About a year ago, he suffered from a stroke, and I thought it would be helpful for him to speak on Heart of the Matter, to share his experience with you, and to also get some knowledge in the area of how to deal with high blood pressure. And I hope that you would find this interview very interesting and very informative and educational. So let's go to the interview. Welcome to Heart of the Matter, Dr. Olatoye. Can you briefly describe what happened to you about 1 year ago?
Thank you very much for the invitation to Heart of the Matter. It's an honor, a privilege to be asked to discuss, on this platform. So I do appreciate the invitation. So my name is Ayo Olatoye. I'm many things. Let's start from in order of priority. So I am a Christian. I am a husband. I am a father. I'm a son. I'm a brother. I'm a doctor. I'm a medicine consultant in acute medicine, and I'm a stroke survivor. So on the 5th of January 2020, I was at work, and I had some pins and needles down my left side. I didn't really think anything of it. I just thought I've had migraines in the past, and there are migraines you can have that can give you some funny symptoms. I just thought it's probably just a migraine. I just ignored it, carried on with the ward round. By the end of the ward round, I was limping, and I remember asking a nurse to check my blood pressure because I was on a half day. So I finished the ward round, I was going home. My blood pressure was high. Let me just try and get some rest. I got home, and throughout the day, I didn't get better. Like I had a nap, woke up, didn't feel better. Had something to eat, didn't feel better. And by that time I was limping quite heavily, and I had some really strong pins and needles on my left side. So when you hit your funny bone, it feels like pins and needles, but it feels squeezing. So I had that all on my left side, and we have a blood pressure monitor at home, and I checked my blood pressure, and it was sky high. So I mean, my thought wasn't so much, oh, I need to go to hospital. At this stage, my thought was, I think I've done everything that I can do to avoid going to hospital. So now I've got to go. So I went, and my blood pressure was very high, very high. I think it was over 200, over 140 in the 2 value. And I had some stroke-like symptoms. I had a CT scan that was okay, but they were like, you've got some symptoms that send you to a stroke center. I had an MRI scan of my head, which showed a very small stroke on the right side of my brain, affecting the left side, and they'd had to give me medication. So I was diagnosed with a small stroke, or what they call a lacuna infarct. And I was diagnosed with high blood pressure as well. And by God's grace, my deficits weren't severe. So I was able to be discharged the same day. And I basically went home, and from that point on was aware of the fact that I was dealing with high blood pressure. I hadn't ever thought about it before.
So you're a doctor and you work in a high pressured environment.
Yeah.
Have you ever before checked your blood pressure?
So prior to that, I think the last time I checked my blood pressure was probably more than 5 years ago. It never registered in my peripheral vision or consciousness to be checking my blood pressure. So no, not really. And the interesting thing is that there was a stroke and high blood pressure in my family. So, but it never clicked,
So I suppose that came to you as a surprise, really.
Yeah, absolutely. It just came out of the blue. I mean, because obviously as a doctor, I know that one of the things that is a hindrance to people taking medications for blood pressure is that any medication has the potential to give you side effects. But most people come into hospital or come into contact with a doctor and are diagnosed with high blood pressure, but they had no symptoms, because high blood pressure in general doesn't give you symptoms unless it's like sky high. And then you've gone from having no symptoms, considering yourself well, to now taking regular medication, which some people have a big psychological line to cross over, and then having to potentially sometimes deal with the side effect of the medication as well. It can be quite a lot.
So you said you have a history of high blood pressure in your family,
Yeah.
and that applies to me too. Why is it that you think that for most of us, because from my experience, I never thought that I would have high blood pressure. It never even crossed my mind.
Yeah, yeah.
Why do you think that most of us who do have high blood pressure tend to not think about it?
I think it's so I think there are a number of reasons. So I think one of them is, like I said, there are no symptoms. So, for instance, if somebody has asthma or somebody is born and they have type 1 diabetes, very early on, they become aware of the fact that they are dealing with a chronic medical issue and adjust their life accordingly. I mean, there will have been the psychological impact of being labeled as something chronic. And I think by the time, if you've scaled your childhood and teens and come into adulthood, trying to identify oneself as having a chronic illness sometimes isn't palatable. It's difficult to do that. And there's a degree to which we're both youngish. So especially when you mention higher blood pressure, it's something you consider as maybe an older person's game. I also think that one of the things that young people do is that they don't necessarily think long term. So somebody in their 20s, 30s doesn't necessarily think about the implications of their actions today on their health in 20, 30 years' time. Yeah, and there are a lot of public service messages that we hear about breast cancer and prostate cancer and how to check yourself and stuff like that. And I suppose there's not as much information in the public domain about just making sure that you check your blood pressure. So if you come into contact with your GP or any sort of other healthcare services, they're going to check. But if you've been fortunate enough not to need to go to your GP, there would be no reason to check sometimes.
So that leads me on to this question. You work for the National Health Service.
Yeah.
And the National Health Service, in my opinion, is probably the largest mouthpiece for the problems that high blood pressure brings.
Yes.
Why do you think that even within the NHS itself, people who work within the NHS go undiagnosed?
So I think it's so there's a reputation of healthcare professionals being bad patients. So I mean, and I do wonder whether we are desensitized to it. So because you're dealing with it every day, the concept of it isn't distressing per se, but often because of the pressures and because of the fact that we're trying to get as much done as quickly, the reality is that sometimes that can be at the expense of the health of the staff. And I don't mean that in the sense of we're being driven like forced labor or anything like that. It's just that sometimes in the sheer volume of people that you have to see, and when you finish the shift, you just want to go home. You just want to go home. You want to see your family. You want to have something to eat. You want to rest. And unless you're the kind of person who is very proactive in that area, I can imagine it's something that you never check. Even people I know who are very health conscious, go to the gym. Like I wouldn't know the last time they checked their blood pressure specifically, regardless of all the other health promoting behaviors that they engage in.
Yeah, so that kind of leads me on to the next question I have for you, is that there seems to be a lot of myths around high blood pressure. So sometimes I hear people say, I'm a very fit person and therefore there's no reason would have high blood pressure? What are the common myths that people?
Yeah, yeah. So I mean, that's part of the reason why I started to have this conversation, because I am young, I am slim, and I would have considered myself fit before this, and I have been diagnosed with high blood pressure, and I've had a stroke. So a lot of the things that people are saying, I don't need to be concerned about it. Some of these things aren't true. So the things to, I think it would help to compartmentalize what we call primary and secondary blood pressure. So most people who have high blood pressure have what we call primary hypertension, meaning that it's high blood pressure because they've got high blood pressure, and when there's a cause that is investigated, no cause is found. Secondary hypertension, secondary high blood pressure is something is wrong, and as a consequence of that thing, your blood pressure is high. Most people don't have that. Most people just have primary hypertension. And there are some environmental contributors, there are some genetic contributors as well. And like I said, high blood pressure doesn't cause symptoms. So there are, for instance, black people. Our bodies retain salt at a higher percentage than our white brothers and sisters. So black people, because where salt goes, water goes, and high salt intake and retention can cause high blood pressure. So even if you have somebody who is well, as a fact of the just because of the fact that they're black, that person has a higher risk of high blood pressure than somebody else. Contributing to that is lifestyle and diet. So it's possible to live a life of being sedentary, being overweight, having a high sugar content, high alcohol content, high salt content. Those things can contribute. And again, because high blood pressure doesn't cause symptoms, it's possible to go years with undiagnosed, untreated high blood pressure, and you think you're well. I mean, prior to having a stroke, I was exercising as much as I could, and I was doing high intensity interval training. There are some conditions that when they're undiagnosed, they impair function. So some people who have diabetes will notice before the diagnosis that they got very thirsty. They might have lost weight, gained weight. They might have started waking up at night and to wee, and they might have had lethargy. And as a consequence of that, they knew something was wrong. In general, high blood pressure is what we call an incidental finding. You're here for another reason, or it's just part of a routine check, not because you've got symptoms, and it's diagnosed. So I think there's that myth. There's the myth of, I'm slim. Some people are just genetically predisposed, or familially predisposed, or environmentally predisposed. So I would say that it's always better to know than not to know. So by the time you're getting into your mid 30s and maybe early 30s, if you've got a family history, it's just better to be informed. Because if you check and it's fine, then fine. Don't check again for another six months. But assuming it's going to be fine could cause problems later in life.
So here at Heart of the Matter, one of the beliefs that I kind of hold on to is that every household should have a blood pressure monitor, irrespective of, whether there's anybody in the family who has high blood pressure, because no matter what our blood pressure is reading, even if it's 120/80, there's always an opportunity to kind of lower that down, because the tendency is when we are exposed to some certain factors, our blood pressure rises. Mm-hmm. And there's always a possibility that as it continues to rise, it might not come back to the level that it was before. And that's why many people go undiagnosed, because it's a build-up over a period of time.
Yeah. Absolutely. So, I mean, there is a medical condition called malignant hypertension, in which the high blood pressure is associated with damage to an organ, and that needs to be sorted out like that. That is a medical emergency. But it's rare, And most people don't have malignant hypertension, even if it's high. So my blood pressure was over 200. That's uncontrolled hypertension. And just like you say, in the moment, high blood pressure that's high doesn't necessarily cause a problem, but over time. So one of the things that I see, again, as an acute medicine consultant, is people who have had blood pressure which has been okay for years and years and years, maybe 5 years and 10 years. And then when I am seeing them because of the consequences of blood pressure that hasn't been tightly controlled for a long time. So yeah, I agree.
Especially over the last year when you had your stroke, well, this has become a very important health area for you.
Yeah.
What are the latest breakthroughs in terms of managing blood pressure?
Well, I mean, I think we've got some very good medication for managing blood pressure. I think some of the latest breakthroughs are from an understanding point of view in terms of public health. So the first thing is that just as there are some, geopolitical shifts with regards to different racial groups and interactions with establishment and stuff like that, one of the things that we realize is that a lot of the things that we think we know about medical conditions have come from studies in middle-aged white men, and the things that we have held as true are true for that group but not necessarily true for other groups. And there's a greater understanding that we have to do better at catering classical traditional medical therapy to people who may not have been of the group that was studied to get all the guidelines. That's one thing, which I think is a positive move, because one size doesn't fit all. And there's some medications, again, as Black people, that we don't respond to as well as our white brothers and sisters. So it's useful to know that, because as things evolved over time, we are now getting probably a better deal in terms of medication. I also think there is a greater understanding and a push towards prevention. So there's an emerging specialty called lifestyle medicine, and so classic. So and let me just there's a greater understanding of the fact that classical medicine is great for a crisis. It's great for an emergency, but it's not necessarily set up to deal with chronic problems, so things that people have to deal with over a long time. Actually, lifestyle is probably one of the biggest factors in terms of longevity and quality of life. So there are sometimes you see these things on TV where people talk about like diet and walking and stuff. There are people that I know, there are studies that have been done in people who have got, let's say, diabetes as a consequence of walking regularly. They are losing weight, and they are putting themselves in a position where there is no detectable effect of diabetes on their bodies. There are people who are lowering their blood pressure, not by taking medications, but by walking regularly, that kind of exercise. So it's having an understanding of that. And I think that is good for the population, because there are some people who are fantastic at taking medications and are happy to put in side effects and are happy to deal with classical medicine in its historical state. But there are some people who are like, actually, I don't want to take medication. I want to see what I can do, and I want to adjust my lifestyle in such a way as to ensure that I can have the benefits of well-controlled blood pressure over a long period of time, but not to take medications.
So, I mean, one of the things that I'm an advocate for is the type of food that you eat.
Yep.
And there are a lot of foods out there which help control blood pressure. Mm-hmm. So things like bananas, celery, foods that are high in potassium, magnesium. What are your thoughts around using this approach to combat
blood pressure?
Yeah.
I mean, I think the reality is that, so as doctors, we are realizing that we have to have a more collaborative approach. And, gone are the days where you come to the doctor and my problem is this, the doctor says, okay, doesn't look at you, take these medications and see you later, where everybody is more informed. So doctors, we're more informed, but the patients are coming in, and patients are more informed as well. So there are a lot more conversations. Patients feel more empowered, which is a good thing to be able to say, actually, I don't want to try that. I want to try this, and that's good. And I think, like you say, lifestyle and diet is a massive topic for discussion. So just as disclaimer, I'm not a nutritionist or a dietitian or anything like that, but specifically you mentioned about foods that are rich in potassium. So the reason it's good is because your body needs the potassium to help you get rid of the sodium. So making sure that you do that can help you control your blood pressure. And I think it's a good thing. I think what I would advocate with that is just proper monitoring. So the way that we understand evidence in medicine is that lots of money has been spent into doing trials so that we can compare this treatment for that treatment. There isn't really a model for that in lifestyle medicine and fruit and stuff because there's no money to be made. So you're not going to find a company like, that makes medicine to say, actually, instead of taking this drug, you should walk. However, there are what we call observational studies. So you have a certain amount of people, the larger the amount of people, the better, because it provides statistical power. And they can say they've had blood pressure, they walked or they ate bananas or whatever. And as a consequence of that, their blood pressure dropped from an average of this to an average of this. And I think it's really important if you're going to do that to make sure that you're monitoring. So because one of the things as a Christian I found is that sometimes as a Christian we are using faith to not take things seriously. But I personally believe that if God is going to do a miracle, that miracle can be proved. For instance, some people are saying, no, just have faith and don't take your medications. I don't think that's a wise thing to do, because personally I believe that wherever healing comes, whichever mechanism or route healing comes from God. So it can be proved. So if my blood pressure is an average is of this, if God heals me, then we can detect that my blood pressure is lower. Until then, don't change anything. Do you see what I mean? Yeah. Because the problem is that some people are saying, oh, I feel better, so I'm not going to take a medication. I know people have done that before, but the problem is that blood pressure doesn't cause you to have symptoms. Yeah. So it has to be measured. So if you're going to have a lifestyle approach, absolutely fantastic, hats off to you, but make sure that you're measuring.
Yeah. I mean, one thing we know about blood pressure, as you've mentioned a few times, is that for many people, they don't see symptoms. Mm-hmm. And I consider myself one of the lucky ones because I saw symptoms, symptoms like the constant headache. And over a period of time, I always had nosebleeds.
Okay.
Symptomatic of high blood pressure. Yeah. And then 10 years ago, when it was detected that I had high blood pressure, the doctor put me on high blood pressure meds. Yeah. And I can only remember that in the last 10 years, I've only had a nosebleed once.
Yeah.
And that goes to show that, while a few people might have symptoms, for a majority of people, they wouldn't have symptoms, and the next time they know it, that they've been living with high blood pressure, is when they have a stroke, as in your case. They have a heart attack, or they have a kidney failure, or, something major goes on. And that is one of the things that you and I are trying to prevent.
Absolutely.
By being mouthpieces for what high blood pressure can do to the body. Yes. And how much damage it can cause. And once the damage is caused, it can be too late at that stage.
Yes, absolutely. And I think it's, like I said, it's important. So I believe that God can heal. That's not the issue for me. But I believe that God's best is for me to live in such a way as to not to cause damage to myself or the situation that I'm in. So I have to be mindful of what I'm eating, how much I'm drinking, the fruits, all that kind of stuff, because those things are within my area of influence. Mm-hmm. And just being mindful of that, I think, can make a significant difference in terms of controlling blood pressure long term.
Thank you very much, Dr. Ayo. It's
No, not at all. Not at all. It's been very, very helpful. I hope people are subscribing to Heart of the Matter and being informed about these sorts of issues, because we need these kinds of conversations in our community.
yeah. And I'm hoping that this wouldn't be the last conversation we have with you. We'll have many
Yeah.
other
I always,
conversations. Yeah.
always need to come back. Always need to come back.
Okay. Thank you so much.
You're very welcome. You're very welcome.
Take care.